that make sense?
Hi.
Hello.
Pin.
The squirrel is weird.
There we go. Ah, hi everyone.
Comment with your questions
Hello.
so we can end.
I can't see myself.
So
We're gonna start in a bit. Hi, we're back.
Hello.
We're
Nice
so
to
sorry
see you.
about
Sorry.
we're so sorry about last
Last week.
last week. That's a problem with working with
Doctor.
an in-demand doctor. Sorry, I'm actually trying to check on I'm checking on audio and I think we're good, so I don't need that anymore, which is awesome. So yeah. So the problem of dealing with a very in-demand doctor is my mom had a mega meeting she couldn't miss that was important. It was actually about a really cool research project. And the IRB, which is the Internal Review Board, for those who don't know, that's how clinical studies happen. You usually have an internal review board with the organization we're working with, could only meet that morning and at that exact time. And it was a really big, important study that can help a lot of people, especially during the time of COVID. So I won't get into it too much. I hope the study is approved. It'll be exciting. We'll wait just a little more, I think a few more minutes to make sure folks have time to get in, and then we'll do the same thing we always do, which is we'll talk about VMV first, and our products and contact dermatitis and patch testing and how that kind of works in our universe. And then we'll bring in my mom, her grandmother, in Filipino it's her Lola, and she'll talk about it in more detail and we'll do a deep dive into it.
Oh, and we'll also do a demo. That's why I'm here.
Bea Bon says acne purging normal if you start new skincare. That kind of depends on the new skincare. If it's something with beta hydroxy acid, like a salicylic acid, which is oil soluble and therefore goes to the inner walls of the pores, it can be common because what it's doing is getting the stuff that's in there to come out, right? If it's a reaction, we have a nice article on that. Let's say acne gens versus comedogens on vmvinskin.com. And it explains that for acne to form, you actually need a little more time versus for comedogens to form.
What is a comedogen?
It's a clogged follicle. Acne happens when it's clogged and then an infection or inflammation develops after.
Okay.
So there.
To get something quickly.
Okay. All right. So in about a minute, I'll get started with more stuff about VMV and patch testing and contact derm. Yeah, definitely comment with your questions. Hi, Facebook also. And so we're on Facebook and Instagram today, VMV Hypoallergenics. I'm Laura, by the way. I don't know if I said that. I'm the CEO of VMV Hypoallergenics. I'm also one of the daughters and therefore the earliest human guinea pig of the brand. I had really bad sort of acne as a kid, so I used everything. And then my daughter and my son are here helping me out today for production stuff, but also Madison, who's here, she's a 13-year-old,
Hi.
is going to be helping her grandmother show what a patch test looks like. And it's actually timely because she just had a bad urticaria reaction the other day.
Apparently I'm allergic to blue dyes.
Yes, blue dye. And
which is weird because I was allergic to red dye and now it's blue.
That's the other thing, is allergies can change over time.
And it sucks.
Wah!
Most of my shirts are blue.
I know, so now they have to be red. It happens. Our bodies change. I mean, my body is so different from the way it used to be.
Maybe it's just that one fabric on the sofa.
Maybe.
Because so far I haven't had
it could also have been the laundry detergent. I know they said they didn't change it, but I don't know.
Sometimes they do.
Okay, I'm going to start, folks. I'll just talk a little bit about contact dermatitis and patch testing. So thank you for joining us today. We've had a few requests to do this again because it is a complex topic, and because contact dermatitis and patch testing are so fundamental and at the core of what VMV is, we'll probably be doing this a few times. So I'm going to be talking a little bit about contact dermatitis and patch testing and how it applies to VMV first. And then my mom, Dr. Viralya Rowell, will come and join us and do a deep dive into it. I don't know if you guys hear that's a helicopter. I hope it doesn't mess with the audio too much. Okay. So VMV basically was created for contact dermatitis. My mom had trained in the United States and already had published a paper as a fellow, I think. So she's been studying, she's been publishing since forever. But she really sort of fell in love with patch testing because basically it can really help fine-tune management for a whole host of skin problems, from what you would expect, contact dermatitis, as well as eczema, atopic dermatitis, but also for things like psoriasis, rosacea, even acne. Knowing exactly what it is that you're sensitive to can help you avoid them much more accurately and avoid flare-ups, avoid triggers, avoid reactions. So yeah, at the time in the 1970s when my mom came back, cosmetics were sort of considered not serious, and there was no definition for what hypoallergenic meant. And actually in many FDAs now, it's still a little vague, and some countries don't require substantiation. Actually, the US FDA doesn't really require registration even.
That's wrong. Sorry.
Anyway,
That sounds.
it's different. It's
Interesting.
different in different countries. And that's Marlo, my cat, who's photo bombing,
Marlo.
who had a skin reaction. So this is timely. So there, basically my mom was sort of at a loss as to what to recommend to her patients who had allergic reactions. And she decided, to kind of make formulations in the pharmacy that had 0 of known contact allergens in the formulation. Right now, there are about 109 top common contact allergens, and they're published by these two amazing groups, completely independent from us. So we look at those publications: the North American Contact Dermatitis Group from the American Academy of American Contact Dermatitis Society, and the European Surveillance System on Contact Allergens. We also patch test all of our ingredients, all of the accessories, so like brushes, everything basically that goes into or touches a product, we patch test. And it's really hard.
How do you patch test a brush?
There's a way. You can take bristles and you apply it. And then for things that are wash off, like cleansers and stuff, there's a specific dilution to it.
Oh.
So there. So for contact allergens, we don't just rely on our own studies. We also rely on these published studies. And I won't lie, it's really hard. It's like baking a cake and someone tells you can't use 109 of the top ingredients, right? So that's what we do. And over 40 years now, we're set up so we can change fairly quickly. One of my favorite examples to give is vitamin E is a fantabulous antioxidant. It's a really, really good ingredient, but it is a top contact allergen. And because we do so much patch testing and whatnot, we actually saw this coming. And because we're so in the literature, we saw it coming, more case studies, more reactions reported. And it happened to be in all 300 products that we make. So rather quickly, we had to remake everything. And it's not easy to do because it's not just replacing an ingredient. You have to find an ingredient that serves the same purpose, is as good, but is not an allergen. So that's what we do. And right now in the United States, it's 1 in 4 people who are allergic to ingredients in cosmetics. And these figures are based on about 28,000 patch test results in the US and in Europe. And those numbers are actually considered conservative because most people who use a product and they get a reaction, they'll just stop using it, right? They'll just use something else. To get a patch test, you have to have reactions fairly regularly. So you're frustrated, you're fed up, so you finally see a doctor, and the doctor happens to offer patch testing. So these numbers are actually much lower than what people think. And they're also on the rise. Eczema is on the rise all over the world, skin allergies as well. So those are the people that we take care of. So what's really cool is because of my mom's focus on contact dermatitis and patch testing and her wanting to find a way to make it more standard what hypoallergenic really meant, she created a system that's like an SPF, but for allergens, for skin safety.
She created that?
She created it. The VH rating system.
I
Validated.
did not know that.
Okay, now you do. I'm such a bad mom. So yeah, it's called the VH rating system, validated hypoallergenic. And the number next to that shows how many allergens of the 109 are included or not in the formulation. So if you would, this will probably be backwards on your screen, but this number here,
You're also going to have to show it.
yeah, I have to show it on Facebook. Oh, it's not, no, it's hard to look at.
Wait,
Um,
there you go. See,
yeah.
the number right there.
That number right there.
That there.
That says VH minus 109 over 109. So it
Yeah.
means validated hypoallergenic minus all 109 allergens out of 109. And then other products that do have an allergen, like vitamin E, for example, you'll see the rating is 108 over 109. And the important thing is on the ingredient list, you'll see the allergen clearly identified, right? And the reason we do that is because it's really unlikely for anyone to be allergic to all 109 allergens, right? So if you're allergic, like to vitamin E, you'll see that it's VH 108 over 109. And in the ingredients, you'll see that it's vitamin E. So you know not to use the product. But if your allergens from your patch test show you're actually allergic to parabens, then you should be able to use that product without a problem whatsoever.
Let me
So
take
all
care
our
of the
products-
person who came in.
Okay. All our products have the VH rating clearly marked to help you decide what you can use. Quick reminder here, and we'll bring in my mom soon. If you've had your patch test already, you can DM us here or on Facebook or on our website, vmvhypoallergenics.com globally or .ph in the Philippines. You can send us a message with your patch test results, and we can customize recommendations for you based on your patch test results and even possible cross-reactants. So that's pretty cool. And then, sorry. Hi. Hi, have a seat. Give me 1 second. So,
Thank you.
patch testing also to keep in mind isn't just for contact dermatitis and eczema. It's also, it can really help with hyperpigmentations because a lot of allergens are also photoallergens, etc. It can help with acne management, psoriasis, etc. So yeah, it's pretty important. In the USA, if you need a patch test, you can go to contactderm.org and you can search actually by your state and city for a doctor who offers patch testing. In the Philippines, you can contact VMV Skin Research Center and Clinics on Facebook, and we can help you out. And if you'd like a teleconsultation with my mom, they can help you with that as well. If you are a doctor watching and you do patch tests, we tend to use smart practice and chemo technique, just to share. So there, addressing doctors is sort of the perfect segue to introduce my mom, Dr. Boralio Rowell, who's here.
Through here. You have to waddle sideways. Waddle sideways.
It's like a show with like multiple people. So,
Hello there.
Hi, everyone.
Hi, sweetie.
Mwah. So, this is my mom. You have to make sure you're seen here.
Hi.
There you go. There. Madison's just going to be lurking in the background.
But
But
turn this off.
my mom, Dr. Boralio Rowell, is a dermatopathologist. She's mega into patch testing and contact dermatitis. Has been speaking and publishing about it for years and years and years. She has something ridiculous, like 200 plus published studies, et cetera, et cetera. And again, you know, kind of the reason we exist is because of her. And the reason we're allergen free is because of her.
She was born also.
Yeah, well, yeah, so I was well trained, but she's the reason why we exist. So say hi to everybody.
Hello, everybody. Good good morning, afternoon, good evening, world, wherever you are.
That's right. That's right. We're friends in the States. Good evening. I hope you're well and safe. To folks in Manila, it's a
Yes.
gorgeous day. I hope you're safe too.
So
And
beautiful.
to our friends and family in Cebu, be safe. Thinking of you. Okay, so to get us started, what is contact dermatitis?
It's exactly what it says. It's a dermatitis that is caused by contact with your skin and mucosa as well. Let's not forget that. Mucosa being anything from in the mouth and nose area as well as in the genital area. Includes the nails. Nails can be affected by contact dermatitis as well. And also includes not the hair but the scalp.
So that's basically it. And it's surprising how many things can be helped by knowing what your allergens are, right?
Yes, but before we go there, if I may, the most important thing to recognize about contact dermatitis is that it's very, very frequently misdiagnosed or missed or ignored. And yet it is so common. Right? I can tell you story after story after story of a baby or a child or an adult with acne, for instance, and the acne just refuses to respond to the usual medications. And so I see the patient and I realize, have you realized that your face is not just pimply, it's and not just red from the acne marks, the post-acne redness. I said it actually has more redness that's diffused. I said this is probably either a steroid acne because you've been using a lot of steroids to possibly treat your acne, or for the bleaching product that is used that often has steroids, or it is rosacea, or it is actually contact dermatitis in this day and age of COVID with the masks
Yes.
and the antiseptics
Yeah.
and the fresheners and all the other chemicals that we're using in our skin now to scare away COVID.
Right. So a few things I want to get in there quickly, right, is as we mentioned, having a patch test, knowing what your allergens are does not just benefit people with contact dermatitis. There are many other things, or rather contact dermatitis maybe more accurately, is something that sort of can coexist with a lot of skin conditions. And certainly in the time of COVID, with all the disinfectants, which contain a lot of allergens or irritants, and a lot of allergens are also photoallergens. So if you have really stubborn melasma and hyperpigmentation, that can be an issue. What I like to really, really emphasize with people is if you know your allergens, you know what triggers your problems, you can just avoid them. So prevention is so effective here and can save you a lot of money in the long run because you don't have to keep buying more expensive stuff. You can actually just avoid the stuff you shouldn't be using, right? So there.
Yeah.
What I wanted to do as a special treat to folks today was show how a patch test is normally done. So I'm actually going to call my daughter back here to show, this is your patch test tray.
Right.
Before I go, this is sort of the stuff that you need as a doctor if you go to get a patch test at your doctor's office. There's going to be, and my mom will get into this in detail, sort of your patch test stuff, the chambers.
There you go.
These are the allergens that get put in the little chambers, and this gets stuck on your back. This thing gets stuck on your back for like 3 days or so. And anyway, she'll get into it in detail, but that's sort of, in a nutshell, what you need for patch testing. And I need to emphasize here, this is not something that you do yourself. You really have to go to a dermatologist, and actually some allergists are already doing it. But an important thing to remember is allergy reaction, irritant reaction reading is a little bit of an art and science thing. So you need someone who's actually really specifically trained in it. Okay, so on that note, I shall leave, and I will have my mom apply a patch test to my daughter. Fake one.
Okay.
Just to show what it's like. Okay.
I have to tell you the truth. I haven't done the patch test myself in years, simply because I have nurses and fellows and residents around me at the clinic. And so after you have taught them for a while, then they do it. I order whatever patch test material I want done. So what we first do is we look for the skin, which is the clearest skin of all, because in contact dermatitis, it can be localized to an eyelid, it can be localized to an ear, it can be localized to various, but then also it can be more generalized in patches, or it can actually be what we call systematized contact dermatitis, in which the whole body is affected. That's another story. So I've chosen this. This is beautiful, normal skin of my ballet dancer granddaughter. And the way we do it is we first, the doctor, this is why Laura was talking about the fact that this is something you don't buy, and because they're available in the internet, that you don't buy this, but you actually go to a dermatologist, because besides looking at the skin all over and deciding, yes, this could be contact dermatitis, I need to patch test this lady, younger. And then, so the doctor decides if it's patch test needed, or I have nothing else anymore to give you. Let me find out by patch testing. I may get some surprises. Okay?
What age can you patch this?
Oh, and the younger ones you can do even at the year 1 or 2. I haven't really done anybody younger than 2 years old, but I know some people who have done it, and they use very few patches, of course. So then the second thing to patch testing. Sorry, I will start. I know. The other thing in patch testing, though, you have to go to a dermatologist in your area that you can approach regarding it, is because patch testing is not just the art of application, but it is an art of interpreting the results of the patch test.
Okay, so how does it go? So you would, let's say, get the gloves.
Yes.
Okay.
Yeah. Normally put on the gloves, which I'll not put on because I'm allergic to this kind of gloves. I have contact dermatitis to rubber.
Yep.
And this happens to be it. Okay.
How about this one?
And then,
And this one, I'm allergic to dyes. And I haven't called the company about this vinyl glove that's very common also. I love it, but there's a white version and they didn't send it to me.
Okay.
So I'm not going to
All right.
put it on. Okay?
so anyway,
There. So
moving
that's the
on.
first thing. And then there's several places that you can buy these things. There's one called Smart Practice, and then there's another Chemotechnique in Sweden. And we can actually make them ourselves when we're doing a series of so many chemicals, and we've run out.
So they can see us.
We've run out of this. We'll go ahead and use what we call the fin chambers that we make according to specs that are, that tell us how to make a fin chamber. 8mm round discs, etc. Okay. So then what we do is we choose the chemicals. Let me put this here first. This is what we call a tray. I can actually tell the nurses that tomorrow we're going to have 3 or 4 or 5 patients for patch testing.
So here, these are the trays, right? They've already been filled with allergens.
These are the allergens.
On the little thingies.
And you have to tell the patient immediately there's no needle. This is needleless. And all we do is then place that to the little discs.
That's what it looks like.
Right. And this is the...
And these are the allergens themselves, if you can see. So this would be like dye. This would have like petrolatum. It would have different things. And usually they're a standard set.
What I use in my clinic for standard patch testing when I don't have a very strong idea, or because there have been many studies that have shown that the more patch tests you do, the higher the yield of relevance after you interpret, you do relevance. After that, there's a greater number of pickup of positive reactions that have relevance when experimented.
Right. So your doctor may actually ask for quite a bit, or if they suspect like clothing contact dermatitis, they might get that tray. Sometimes doctors will even patch test with a suspect product that they think is the one that's causing the problem. So you've already identified the area, right? It's usually sort of the mid to upper back. You try to avoid the waist.
So it's placed like that.
Yeah.
And so the chemicals are here, it's placed like this. And there's a tape back in here. So then when you put it on, What's left are just squares. I gave to Laura a series of pictures of how this looks when it's in place,
Right.
including the PATS test results, which are really quite
Right.
good.
So the
to see.
point is, she would have that, for example, plus like more of these, right?
1, 2, 3, 4.
And then 5, 6, 7, 8.
Because this one is 10,
Right.
and it's an 80 allergen, core allergen series
Right.
based on the American Contact Dermatitis
And so
Society.
all of this would stay on, right? 8 of them like this. And then she'd have to shower. So Madison, when you had this done, what did you do when you showered and stuff?
I have a removable head thing. Ow.
Yeah.
I have a removable head for my shower, so I would just do my best not to touch my back.
Okay. Or you could lean forward.
Yeah.
You're also not supposed to work out or do anything so sweaty, because
Right.
the more sweat, the more it can futz with the readings and give you false positives or whatever. So after you have all of these things on your back, you go home, you live your life regularly, but without too hard to work out and without getting your back wet. And then you come back when?
In 48 hours. So that's for 2 nights.
Right.
So if we were to do it, apply them on a Monday. So you take care Monday and Tuesday, and then you come back on Wednesday. We remove all of those patches, let it breathe for about an hour, and then after 1 hour, we read it.
Yeah.
Now there are, whether you're in a cold country or in a tropical country, there's a lot of sweating. You know, so after the 48 hours, we do 1 hour reading, but usually we get a great idea already of what may turn out to be really positive.
Right.
But because of the changes from pressure of the tapes,
Yeah.
as well as the edges of the tapes, as well as of the tape itself, there will be a reaction.
Right. Because remember, this is all on, right? 1, 2, 3, 4, 5, 6, 7, 8. And then they put tape sometimes even to make sure it stays there, right?
Right.
After the 48-hour reading, you go away again.
We cover it again.
You cover it again, and then you come back again
Mhm.
at about 72 hours.
Right. Some people do it in 72 hours because in the tropics there are people who there are studies rather that show that 72-hour reading is enough for tropical people, but most of our people don't really stay in air-conditioned places, so they're sweating it still. So in order to avoid all of the pressure and sweat changes of the skin and just have the result from the allergen itself, I always do a 96-hour reading, which is the standard anyway. And occasionally, there are some which are slow positive reactors. So I'll ask the patient normally, I'll explain everything to them, and I'll say, can you come back in 1 week? Or can you take a good picture? You know, the iPhone is pretty good, really. They very, very nice pictures. And we teach them how to do it so that we can really see it and then compare with the previous one. And then that way we have 96-hour reading.
And at the end of it, her back would look like it would have some red spots and some nothing. And then you'd even see some markings from a marker where they would show, okay, we're looking at this, we're looking at that, etc. And then all of that would be entered. Thank you, Daddy. We're done.
Thank you so much.
You also have some questions here on
Yes,
this.
I will make sure to get to that.
Thank you,
So
Madison.
then, yeah, after reading all of that, then the doctor decides this is a +1 reaction, +2 really bad, this is just an irritant reaction. And then you get a printout of all of the stuff, your allergens that you need to avoid. If you get this done in the United States with a doctor who's a member of the American Contact Dermatitis Society, they have something called CAMP, which is the Contact Allergen Management Program, which is really cool because they'll print out your results and print out brands that you can use, actually, that don't contain your allergens. And guess who's always there? But I won't get into that. So anyway, here we give you the list of allergens. And that's why it's helpful to have us customize recommendations for you, because sometimes it's a little hard to understand that. But your doctor should sort of walk through that with you. Okay, we will get to some questions just to make sure we don't miss any. Why is my eczema starting so late? I'm 47, and it's getting worse as I get older.
That's another clue for contact dermatitis rather than just ordinary eczema, which is the common name and usually refers to what we call atopic dermatitis. I agree, atopic dermatitis is part of what we call the atopy group, and that would include uh, bronchial asthma, rhinitis, allergic rhinitis, and atopic dermatitis. They start quite early in life. Very often by the age of 2 or 3, they're already scratching away and itchy like anything. And then it just becomes a little bit more worse as the months go on. Usually, a number of them by the age of 10 may get over that atopic dermatitis, but majority go on and still are itchy. Will come to me when they're 60 and say, "I've always been had sensitive skin," or for instance, like that. But if your original, the first time that you began to have reddish, itchy rashes here and there, and got to be diagnosed as eczema. It's not eczema, by the way, is a broad term. It just means it looks like it's boiling over when we do a biopsy.
Bubbling,
It
right?
looks like
The little
bubbles, right? So it depends upon the age
Right.
when we see them. Bubbles at the beginning, little patches, and then becoming thick, and from scratching becomes what we call lichenified. So, yes, very often,
It can
later
start,
stage,
yeah.
yes.
So just to add to that, I got a nickel allergy late in life, and I didn't get an allergy to penicillin internal, no, until my second child. So our bodies change.
Right.
Things can happen. I was never. That's not true. I was allergic to nickel as a kid, so I couldn't wear earrings, right?
Mhm.
And then for years I was fine, and all of a sudden, about 5 years ago, I couldn't use nickel again. So your body does change.
Yeah.
Remember, we're a system, so things don't stay stagnant. So people who are like, "Oh, I've never been allergic my whole life. I can use anything." That might not be the case forever. And also the way allergies work, right?
Okay.
You can use something for a long time and slowly have a sort of mild irritant reaction that
Until you
looks,
get into a threshold.
until you hit a threshold, and boom, all of a sudden your cells are like, nah. No.
I know you've been using blank since you were a
Exactly.
kid as a moisturizer at night, or I know you've been using this, but let me explain this all over again to you. Maybe I should have you do it.
Another batch test. Just a quick one here from SEI Buckeye. There is a camp app, which is also great. Absolutely. Thank you for bringing that up.
Right,
That's
right.
so true. We have Achi Abs asking, can I be allergic to my sweat?
Yes, very much so, but it's not really the sweat.
Yeah.
It's what comes out of the sweat pores from things that you take internally, because there are some drugs or some chemicals that you can either breathe in or take internally, imbibe, that are small enough that they can get through the sweat canal and into the pore, and therefore you'll itch there. But it's not the sweat per se,
Right.
but the
It's,
chemical.
it's either what you apply to your skin that can
Yeah.
come out, or even what you're taking internally.
Right.
That can
The
help
other
as
thing
well.
about sweating is that also because you perspire so much, it facilitates contact dermatitis. So it may be from inside, it may be external from the things that you're doing, and because of the sweatiness and sloppiness of the skin allows a greater diffusion of the chemical that you're allergic to, so that you think it's my sweating. It really isn't. It's the other chemicals, from internal or external.
Just a comment from Rubandi Okino. Just a big fan of your Armada line. Thank you so much. It's very hard to make. I won't lie, it's such a pain in the butt, but it is very good. A lot of times we hear, "Oh, I tried this product, and it gave me a rash or acne. Clearly, I'm sensitive to it." What would you say to that?
If you're using a product for the very first time, and if I look at the chemicals in the back, and there are things, well, most likely people don't know anyway, but if it's at the very first use, it's not an allergy. An allergy takes a minimum of 7 induction days for the skin to become familiar with it, and then decide. The T cells is what it's called. Your particular cells that are involved in contact dermatitis are called T cells, and what they're like sentries that roam around our body. And when some new chemicals, they're guardians, we watch for it and we say, they're okay. But if it turns out to be something that the T cells recognize as foreign, then therefore you will eventually, in 7 days at least, or many times in 40 years, depends upon the threshold dose that your body needs for it to recognize something as foreign.
So here's the other thing I want to add to that quickly is when you look at the ingredient list of a product, you'll see it's never just one or hardly ever just one. So it's really hard to figure out what is causing the reaction, right? It could be any one of those ingredients or several of them. So if you're getting a reaction, a couple of things, it may not be the last product that you applied. As she mentioned, you could be using something else that's actually, you have a mild reaction to it already, and then you hit a threshold, and then finally you get a reaction. And just because you use something else and it happens at the same time, you think it's the new one. It may not be, right? Second is because there's so many ingredients in the product, you don't really know what's causing the reaction. It could be any one of those things, which is where a patch test comes in really handy to help identify it. Patch test and food test, food allergy test.
Let's talk about photo patch test.
Okay.
Photo patch test is something that, again, just like the identification of contact dermatitis being there in your skin as a primary problem or as a secondary problem, it is equally common. Secondary, for instance, to contact dermatitis, to psoriasis or rosacea or acne or atopic dermatitis. That's another subject because it's very, but anyway.
Check out the IGTV. We tackle eczema and psoriasis.
And where they meet, considering that one is mediated by T cells and the other one is by B cells. Okay, where was I?
So we were talking about, I'm so sorry. We were talking about photoallergens.
Yes.
Many allergens are photoallergens, meaning they react with light to cause darkening. Common ones, dyes, preservatives, fragrance.
Those three in particular are classic. Desensitizer. And they're everywhere.
Yeah. Okay, so a lot of people will say, hey, I'm allergic to corn or I'm allergic to coconut, so I can't use anything with those ingredients. And we always say, that sounds like a prick test, which is a food test, or like pet dander test. If you saw the patch test earlier done on Madison, it doesn't hurt at all. There's no pricking. There's no injection. There's no needle. It's just applied topically on the back on your back, on the skin on your back. A prick test is different. That's when you get the pricks to figure out if you're allergic to certain foods or dust mites or pet allergies. So is that this? What are your thoughts on that? On food
I think
versus patch testing.
I see a lot of patients who come in and say, I'm supposed to be allergic to shrimps, or I'm supposed to be allergic to mango, or, and they said, but I can actually eat those things and I don't get an allergy, So a little bit, it's an interpretation as well that can be, that an allergologist can help you with. For me, I prefer a patch test first. And then if we do not identify your allergens there, perhaps a prick test will do. There's another kind of patch test called an atopy patch test, which is also food. But instead of just putting them in by pricking, they're also tested directly on the skin like a patch test. There are many variations, which again, if I may remind you, please do not do this on yourself or go to someone who seems to be just doing it initially. Go to an expert on contact dermatitis. There will be dermatologists because there are lots of members of the ACDS, of the American Contact Derm in the States. In Europe, oh my God. Remember, contact dermatitis was actually started in Europe, in France as well as in Sweden, in the Scandinavian countries, and then Germany and all. But every country has fantastic contact dermatitis experts. Saludo.
Okay, let me quickly get to some more questions. Make sure we get as many of them in as possible. Achi Abs, how do I book an e-consult? DM us and we'll help make that happen. Or visit, PDS rules. I can't really say how. Just DM me or DM us here in VMV. Pau Socks, what is the best ingredient to heal post-inflammatory hyperpigmentation? We have an IGTV on hyperpigmentation and melasma. We really cover that there. Hydroquinone, generally safe, but not for long-term use because it can cause ochronosis. Steroids, same banana. But check out that IGTV on hyperpigmentation and melasma.
And people use lasers and all of that. I'm a little bit of a purist on this thing.
But also, just to bring it back, because we're talking about contact dermatitis and patch testing today, if you get a photo patch test, that can help you really, really lessen the hyperpigmentation because you might be exposed to photoallergens in products you're using. A lot of lightening creams have photoallergens and sunscreens even. So as you're using the stuff that's supposed to lighten your skin, you could be causing new hyperpigmentation.
Correct.
Or you could be gardening and you could be photoallergic to plants. So it's a patch
Or the
test.
chemicals used if you're not an organic planter.
Okay, from Jean Olga Esperanza on Facebook. Is it possible that I'm allergic to my maintenance skincare from my doctor? I was told I can use that forever.
It depends upon what kind of rash. What you should do in cases like that, you go back to your doctor and say, I don't understand. This is supposed to be my maintenance forever, but I'm changing. I'm 30 and going on 50 or 40, going on 49.
Yeah.
You know, we change. Our body changes.
Mm-hmm.
The skin reactions of a younger person is different when you're older already. And the exposures we have to sunlight and indoor lights, in particular during COVID, we're all indoors and looking at webinars and conferences and study, things there that we can look on in the internet.
So
Which reminds me.
we have so much to talk about. You have to go soon. I know
Okay,
you have an
okay.
appointment. Short answer is yes. You can develop an allergy to products that you're currently using, even if they're prescribed by your doctor.
That's right. So follow up.
Follow up and patch test. This is a great question from Nisi Lara on Facebook. Is it still an allergy if when you apply something to your whole body,
Mhm.
it only always reacts to a specific area? Fabulous question.
Very good. You're applying it all over the body, but it's only in certain areas that you're getting the rash. That is probably going to what the doctor would be doing in that is clear the whole thing first, get a thorough history, try to already suspect certain chemicals, avoid them. I even sometimes put my patients in the hospital if they're both photoallergic as well as a generalized allergy. I'll hospitalize them in a darkened bedroom where only a flashlight
Yep.
is used, and just cool them down.
Try to get the skin back
Right.
to as
With-
calm
with-
a
yeah.
state.
without any chemicals. For instance, all I use is coconut oil because I've never seen an allergy to coconuts. If anybody has it,
And
you let
it's-
me know. I
it's-
need to find out. But anyway,
I get to
the
that.
only things I use would be just the coconut oil to
Pure,
Pure.
organic virgin.
Right.
coconut oil.
for repair of that barrier, because the barrier layer in contact dermatitis is really severely damaged, not just from the contact allergen, but also from the steroids that are usually applied on the skin. So we need to cool down that skin, bring down the inflammation without much of any oral or topical. And amazing, they just by nursing care 2 or 3 times a day after a bathtub, they're fantastic. So that after all of that inflammation is gone, sometimes with certain drugs, but not. I know you give steroids because that's what's
It's a
been
whole
given to
other
them,
bag of bananas.
right? So and then when I do a patch test, it should be the rules are there for the doctor about one month for steroids and so on. We kind of go against the rules a little bit, and do it earlier so that the patient can identify already as much as possible. They'll get what we call an irritant dermatitis, and what do you call that? Anyway, the whole back sometimes will become red, but there are places that are redder than others.
Okay, so in a nutshell, right? If you're using a product and you only seem to get a reaction in your face, a couple of things will probably need to happen. Your doctor will probably need to take a very thorough history to figure out, is there
Very.
another contributing factor to the face? For example, classically, first thing comes to my head is your face is far more exposed to the sun and to light. She mentioned earlier, you're on conferences all the time, you're next to a window, you're just walking around. So you might be getting actually a photoallergic reaction.
Mhm.
There might be something in some ingredients that are just reacting to light. My son is very photosensitive, and oddly enough, here and his ears. So for the face, we use a purely physical mineral sunscreen, and for the rest of his body, we kind of don't have to. So that might be a contributing factor. It could be your hair. It could be something from your shampoo or conditioner. So you would need a really thorough history and to look at the patterns. And if it's really constant, you'd need to do what we call a 7-day skin fast, or even a more extreme elimination to make sure your skin is as non-inflamed as possible. Then do a patch test and really try to identify what's causing the problem.
Correct.
So I think it's a great question. Who's it? Gay Tongol Dumnao Santos. What skincare should I use to have combination skin? Stick around after when she's gone. I'll get into that. Kim Safa, how accurate is patch testing? I had one done 3 years ago and one this year and had two different sets of results.
By the same doctor?
I don't know. but your so we mentioned earlier, your allergies can change over a lifetime, right? So I had nickel issues, then did not, then got them again. I never had penicillin issues, which is not a topical allergy per se, but I had it later in life. Patch test results can also change, right? And 3 years.
I'll give you an example. I have a patient with psoriasis that's pretty severe, generalized. The first time I saw her, whole body was red, thick patches and all of that. Steroid treated like crazy. So I finally did the thing I told you about admitting, and within about 2 weeks, she was starting to really get better. In a month, I was able to do a patch test knowing that she was just on cyclosporin at about 50 milligrams, which I think is allowable. I told her, I'm going to do a patch test now, but I'm going to be repeating this in about a year just to be sure that the results I'm getting will be the same. So the results on that first thing was I got 2 and 3 plus reactions to certain dyes, to certain fragrances, like that. So her number 1, 2, and 3 were preservatives, dyes, and fragrance. I therefore eliminated all of that in what she was using in treating her body. And she slowly, over the next year, she became 100%, earlier than a year, 100% clear. But wait,
Okay.
a year later, I repeated the patch test, and lo and behold, a very clear patch testing just showing that everything else in that angry back that she had a year ago had disappeared, and now we were really getting the true, and it was in fact truly the fragrance, the preservative.
So some of this takes a really long time. This is a very important question. Kay is asking, is topical steroid withdrawal real? I'm curious because I've been using steroids for quite some time. Absolutely real.
Absolutely.
And mega problem. First, guys, topical steroids are fantastic and necessary when they're necessary, which is usually for a short time, a few times a year. If you're using it every day for several months, or you've been using it for longer, this is a real concern. Regular use of topical steroids over time can cause serious skin problems. Talk about thinning the barrier, but also Cushing's disease. Like, it's a big deal. So this is the number one goal, is to try to get you off of regular steroid use. In terms of steroid withdrawal, absolutely, the rebound effect is no joke. She deals with them all the time.
Listen, we're going to have steroid withdrawal here. That is why I'm going to give you the antihistamines and all that. And I said, but expect you to at least not become very severe, but you may actually become more severe, and you're thinking, what kind of a doctor is this? I warned them, the steroid withdrawal.
It is no joke.
Yeah. So it takes about a month. Depends
She's
upon how long you've been using steroids.
She's had to hospitalize people for close to a week. Make sure all the lights are off. We do the laundry with our own laundry detergent. We give them sunglasses just to calm everything down, because the rebound effect is no joke. It is hardcore. The great news is all the time, after that initial awfulness, the skin is so much happier. And these people move forward with such simple prevention, and they're happier. Everything's just great. So very real risk, folks. That should be number one. How soon after using Protopic can I go back to using VMV Cosmetics products?
That's Fairfield.
Yeah, I'll talk about that later. But basically, again, the goal is to get you off of steroids. We would normally recommend a complete skin fast with just coconut oil. Quick note on coconut oil. A lot of people are like, oh, I'm allergic to coconut oil. The only thing we're really seeing in medical literature is a reaction to RBD coconut oil, which is like normal cooking oil. RBD stands for refined, bleached, deodorized.
By chemicals.
And those words should already alert you to it's got stuff in it and how it's extracted and processed and stuff. But if it is pure, organic virgin coconut oil, not stored in vats used with other oils like aromatherapy oils with fragrance and whatnot, it isn't an allergen, and it works very well for the skin fast. That's usually what we give to get people back to normal. Other questions. Rayan and Pisola, how about skin dermatitis? How can we remedy this? We have a great IGTV on eczema and psoriasis. atopic dermatitis, if that's what you're talking about. It is a skin allergy. It is inflammatory. So anti-inflammatory practices, a patch test, avoiding your triggers. I'm rushing through this because she has an appointment and I'm going to be yelled at. And then Nisi Lara, I like this question. I wanted to make sure we got this. If you can tolerate an allergy, is it safe to keep applying the product in the hopes of desensitizing your skin? Does that ever work? I love the question.
Well, that's the principle actually to the desensitization that allergologists often will use, which is tell you to use a little bit at a time, and then hopefully it will go away. It's essentially also their desensitization of giving you a little bit and a little bit less and a little bit less. Yeah,
I wouldn't risk it,
I
folks,
wouldn't.
because she keeps talking about first two main things, right? One is inflammation. Inflammation is so linked to so many skin and health problems. So the less inflammation, I guess, in your life, some inflammation is good. It's necessary for our health, but this kind of inflammatory response is just not something we would court normally. Second is the more that happens, the more you thin the skin. And it's already such an issue, and the thinner that barrier layer gets, just the more problems.
Yeah, remember that barrier is the most plagued
Important.
part
Yes.
of our skin because it's the most superficial part of our skin, and it's a very thin film.
She's
that
saying
protects
hi.
us for the rest of the world.
Nisi pala is from UST Med School,
Hi,
third
Nisi.
year. Hi, that's awesome. Okay, Mitch Varilia, can we take monolaurin tablets on a long-term basis to control acne?
Sure.
Monolaurin, remember, is found naturally in breast milk. So yeah, it's working for you. I'm going to let her go because it's so late already. I said I'd let her go at 9:45 and it's already 9:52.
Thank you.
I love you.
I love you.
So see, I'm not allergic to her at all. She's awesome.
Bye, everybody.
Bye. I will quickly.
This is
because I have
fun
8
chat.
minutes.
I like this.
I'm sure.
Oh.
I'm sure we'll get back to this.
And
again.
remember again, 1 second na lang.
Yeah.
I train in the United States at the Cleveland Clinic. I bow to because they've done a wonderful job that continues teaching and training and everybody, including they have Middle East and other places, that Florida. So I train under Dr. John Haswick. Henry Rennick's a good friend.
Look for Dr. Fran Stores and
Yes,
Chito Cruz.
I'm mentioning these names.
Berg Stresser. She always wants to shout out her peeps, the
Yes.
people who trained her, and she's awesome. However,
These are the people
Cece
I
is
train under.
literally waiting for you.
Yes.
So you got to go.
Oh, I've got to go. Bye. Cheers.
Bye.
Oh my God.
Okay, I will quickly go through things. To the lady who asked about what skincare regimen to use for combination skin, the Super Skincare line for combination skin is a great idea because it tackles a bunch of things from dryness to acne to hyperpigmentations at the same time. For patch testing and contact dermatitis, if you need a teleconsultation or a patch test in the United States, contactderm.org is very helpful. You can search by your zip
Or
code.
come to the Philippines. I'd love to see you.
Or come to the Philippines. Patch test, you're not supposed to do that. If you'd like a teleconsult, just DM us here or on Facebook at VMV Skin Research Center and Clinics. Look, guys, at the end of the day, VMV is all about kindness, safety, anti-inflammatory protection, proven effective care. But we are prevention, prevention, prevention. So the least amount of contact allergens that you're in contact with is great. If you have had a patch test, remember to DM us and we can help customize recommendations for you based on your patch test results. If you haven't, look at our products at the VH number and choose the highest VH rating to be safe. You can shop all of our products at vmvhypoallergenics.com internationally, and in the Philippines at vmvhypoallergenics.ph. Follow us on social media, Facebook and Instagram and Twitter and whatnot.
We also have YouTube, no?
We do. We have an online exclusive Stay Safe kit, which has a lot of the sort of standard virgin coconut oil monolaurin containing products, especially for the age of COVID, which are disinfecting but less drying and barrier disrupting than anything else. Our shaving line is up to 50% off. And I want to make sure I get everything in. We'll be doing live streams every Friday, 9 a.m. Philippine time, and that's every Thursday, 9 p.m. Eastern Standard Time in the U.S. I think that's it. I don't think I missed a major question. Oh, wait, Janice Soriano. I feel like I know you. Experiencing excessive sweating on her forehead and hands. Use it gel. Absolutely can help. Even the antiperspirant can help, but don't spray your face. Pour it and apply it gently.
Oh God.
The skin fast. Yes, this I wanted to get to. If you are experiencing a reaction and we want to make sure it's not the product you applied last or whatever, we DM us, PM us, email us. But basically, it's 7 days where you don't use any product on your skin except virgin coconut oil. Sorry, it's kicking her out of the view. Virgin coconut oil that we can provide in a free sample, and you use that for about 7 days. A shampoo, conditioner, we can also give you something allergen free, and toothpaste. But it's to make sure that we have a controlled state, and then you slowly start introducing stuff. This is on vmvinskin.com, as is so much of the stuff on blog posts in vmvinskin.com, and our IGTV has everything as well. We'll try to get to other questions another time, but I'm going to get kicked off. So please keep them coming. Let us know how we can help. And thank you for joining us. And we'll be back next week. Yes.
Are you guys willing to see a video of
Yeah.
many of us doing our routines?
Would you be interested in seeing our regimens? Because I use 9 products. She uses like 3. Anyway, let us know in the comments.
So yeah, let us know.
And we'll see you guys. And yeah, stay safe and everything. Mwah, mwah,
Bye,
mwah.
bye,
See ya.
bye. Oh, I gotta end this now.
Mm-hmm.